Today, I'm going to talk about the relationship between childhood adversity and social and emotional development across the lifespan. To introduce this topic, let's consider the popular television show This Is Us, pictured here. This Is Us is a hit drama on NBC that chronicles the Pearson family throughout the lifespan. The three Pearson children, Kate, Randall, and Kevin, called the Big Three by their family, all experienced childhood adversity when their father, Jack Pearson, pictured here, died from cardiac arrest after smoke inhalation when the Big Three were in their late teenage years. Now, what is an adverse childhood experience? Adverse childhood experiences are really difficult and stressful events occurring before the age of 18. Dr. Vincent Felitti, pictured here, and his research team began the original adverse childhood experience study in 1998 to look at how these difficult events in childhood are related to health symptoms later in life. Questions regarding these difficult childhood events fell into categories including abuse and household dysfunction. Other researchers may include a category of neglect. On this slide, we see a graphic displaying 10 types of childhood adversity: physical, emotional, and sexual abuse, physical and emotional neglect, and various household experiences such as mental illness, having an incarcerated relative, domestic violence, substance abuse in the home, separation, and divorce. Would Felitti have categorized the death of Jack Pearson to be an adverse childhood experience for the Big Three? Maybe not, but the classifications of these difficult events are growing and evolving. Dr. Felitti did his research in a health clinic, and his patients were mostly white and middle to upper class. Since this study in 1998, there has been a call for studies to look at different groups of people and different types of experiences. Some of these different experiences outside of the home may include things such as racism, neighborhood safety, bullying, and foster care. Individuals with more of these experiences may be at a greater risk for things in adulthood, such as depression, suicide attempt, alcoholism, cancer, heart disease, stroke, among many other things listed here in this graphic. We see challenges arise in childhood, persist through adolescence, early adulthood, middle adulthood, and late adulthood. To dive into some more examples, children who have experienced childhood adversity may struggle with emotion regulation, learning emotions, and/or being aware of their emotions. Adolescents who have experienced childhood adversity may demonstrate difficulties with psychological adjustment, anxiety, or depression. Individuals in early adulthood may struggle with worse mental health status or more substance use. Difficulties can continue to persist throughout middle and late adulthood. Individuals in middle adulthood may be more likely to have 2 or more psychiatric disorders. The researchers in this particular study asked about a variety of disorders, such as mood disorders, anxiety disorders, PTSD, substance use disorders, personality disorder, and conduct disorder. Individuals in late adulthood may have lower life satisfaction. Some of these symptoms can persist 70 years after the adverse event. It's important to note that this is not a list of all outcomes, and outcomes can look different for different people. Some factors that may influence this might include gender, race, and sexuality. So, what now? Adverse childhood experiences are very common. The CDC estimates that 61% of people experience one or more of these difficult childhood events. Different researchers have gotten different percentages depending on what questions they asked the people within their study. This may mean that the 61% could be higher or lower depending on the researcher. It is highly likely that someone in your life has experienced at least one adverse childhood event. So, what do we do with this information, and how do we connect this back to the Big Three Pearson siblings? Let's start with Kate Pearson. Throughout the series, we see Kate and her mother, Rebecca, both pictured here, undergo changes within the dynamics of their relationship, from the rocky teenage years to the close relationship depicted in later seasons and also here on the screen. Here's a quote from Kate. "Mom, I know that our stuff, it can be complicated sometimes, but it's because all that I've ever wanted was to be like you. I want to be a singer like you. I want to be a mom like you. I want to have a marriage like yours. Mom, you are not in my way, you are my way." Researchers support the idea of a buffer to help reduce some of the effects of adverse childhood experiences, and Rebecca arguably serves as a caregiver buffer for her children throughout childhood and beyond. Here we have a quote from Rebecca. "I'm terrified that I'm going to make 100 wrong decisions to keep you guys from living the perfect lives that you deserve. But I will protect you fiercely, and I will always sing to you when you can't sleep, and I will always be excited to hear you laugh." Additionally, we see Kate's intentional parenting with her own children and stepping into the role as a buffer for her future generations. Here, we see Randall, another Pearson sibling. On the screen is a conversation between him and his therapist. His therapist asks, "So what brings you here today?" And Randall says, "It's kind of a long story. You got an hour?" We see Randall begin to work with a therapist in season 4 after his home is broken into and he struggles with severe anxiety. In therapy, we see him working through past trauma, including the loss of his adopted father and his biological father, and the feelings associated with Rebecca Pearson lying about his birth father. Researchers urge for the incorporation of childhood adversity knowledge in clinical practice. By better understanding how these difficult events relate to various challenges and how these challenges come about, we can better support treatment-seeking individuals. Additionally, growing up as a Black child in a white family, Randall faces additional unique stressors compared to his white siblings. Researchers suggest that some adverse childhood events, such as racism and discrimination, may be reduced through changes in laws and policies in schools, government, healthcare, and jobs. Pictured here is Kevin, the third Pearson sibling. We see him on the right at 3 different time points. From his struggles with alcoholism to his difficulties in relationships, we see Kevin continuously adapting to life's challenges. In other words, we see Kevin demonstrate resilience or bouncing back throughout his life. Here we have a quote from Kevin. "Grief is a tricky thing, you know? You just can't prepare for how it's going to make you feel or how you'll handle it. Sometimes you just got to grab onto whatever's around you just to survive." Researchers suggest the promotion of resilience to help overcome challenges that happen after difficult childhood events. Now, this can look different depending on the stage of life and the group someone may be working with. For example, to promote resilience in community college students, organizations may try encouraging peer relationships, mentoring, creating groups, skill development, and supporting the students' cultural and spiritual practices. Although there are many other ways to counteract the challenges associated with childhood adversity, such as regularly screening for these events for all people, the big 3 show us examples of the importance of having a buffer, providing quality therapy, having fair policies and laws, and bouncing back after adversity. Thank you.